Our team cover a whole raft of things to do with all things volunteering in the NHS, but also our partnerships in various diverse ways with the voluntary sector as well. My role in particular, I am a volunteer manager by background, having worked in the voluntary sector for a long time, and my area of specialty in NHS England is about projects that support the growth in sort of quantity and quality of volunteering, and so I find it a fascinating role, and it's a great opportunity to meet all of you. It's an area of volunteering that I have not personally been involved in. My background is more sort of youth volunteering, but I do have background in St John Ambulance volunteering, and that tends to be one of the areas that comes a little bit closer to community transport. So I'm very, very happy to be able to come talk to you today about the new NHS volunteering website. I've got some slides, which I will just share. I do have a tendency to meander off them. I meant to have a co-presenter today, but unfortunately she is sick, so might not be as polished as normal, but we will persevere. Let me just put them onto the correct. There we go. Lovely. Can someone, I can now no longer see any of you. So if someone can just come off mute and say that they can see my slides, that would be very helpful.
We can see them. We can see them, Nicola.
Wonderful. Okay, so before I get into the service, I wanted to talk to you a little bit about why we are working on what we're working on. So off the sort of back of the peak of the pandemic, and the NHS realised that there'd been a huge groundswell of support for volunteering in all its different forms and varieties, to support the efforts in communities around the pandemic, supporting isolated individuals, helping keep the machinery of the NHS going. And we really wanted to galvanise that and make sure it had a lasting legacy. And so we created a 5-year vision for volunteering in the NHS. And I won't read all of what's on the screen, but by 2028 we are hoping to see growth and change in volunteering in the NHS that has really tangible patient experience and patient outcomes, and supporting staff, reducing pressure on staff and services, and also really importantly an improved volunteer wellbeing offer, and the quality of volunteering within the NHS. We know that volunteering in the NHS is really fragmented, and the support offer in different areas is very, very variable for lots and lots of different reasons. And something that was really emphasised in the NHS Volunteering Task Force review that engaged lots of different stakeholders and was sort of government commissioned to look into this, how we might go about galvanising the COVID legacy, really emphasised that we need to maintain appropriate volunteering infrastructure and reduce barriers to volunteering. And in particular, within the recommendations, and there are a lot of them, and I can share the link in the chat. It's on the slide deck, but I don't think you'll be able to click on it from the screen because of the way I'm sharing my slides. But we wanted to streamline the recruitment processes and find a better way of matching interests and availability with the right type of opportunity. And we want to see a single place where people can search for all available NHS volunteering roles so that people can find the right role for them. We also want to have more standardisation to a degree around volunteer management, and widen access to volunteers and volunteering. And so what that looks like has various different strands of work, but one of them is a find and apply service for volunteering, and that's where the NHS volunteering website comes into play, and that's what we've been working on, and that's what I'm here to talk to you about today. It is not just a service for NHS organisations. In fact, in the fullness of time, NHS organisations will probably be the minority on it, because when we think about what volunteering in health actually looks like, it's not really the NHS in quite a surprising way. So the research indicates that there's about 5,000 voluntary sector organisations supporting health in England. So we've got 210 NHS trusts, we've got our primary care networks, we've got various other bits of the NHS, but that's never going to be 5,000 organisations. And whilst they don't all involve volunteers, there is a huge amount of voluntary sector input into health. And unfortunately, in the UK, we've seen a 20-year decline in volunteer involvement, slowly, slowly, slowly. There was a spike back up during COVID. But as you can see in the graph on this slide, even the COVID spike doesn't change the trajectory. And in 2023, 4 in 10 organisations stated they didn't have enough volunteers to meet their primary objectives. That was through the VCSE Observatory survey. And that's quite worrying, and that's worrying to the NHS for a lot of reasons. One being the health impacts that volunteers have and the health impacts of the lack of volunteers. And so we really need to do something about that. I mentioned earlier that volunteering in the NHS is somewhat fragmented. If you think about an individual sat at home, say that they've had a really positive experience with part of the health service, or they've had a change in circumstances where they've got a bit more time, or they want to gain some skills, or whatever the driver is. If they sit at home and go, I want to help the NHS, and they think about where they live, that pin is on my house. It's an absolute cacophony of information. You've got acute NHS trusts, you've got a community trust, you've got a mental health trust, an ambulance trust, you've got hospices, some of which are private, some of which are NHS, some of which are a bit of both, depending on who you are. You've got GPs, pharmacy, optometry, you've got something called an integrated care board, which no member of the public knows what that means. You've got NHS charities fundraising for the hospital, but then you've got voluntary sector organisations fundraising for health activities, voluntary sector organisations who are delivering direct services to patients, to families, to carers. You've got national charities, local charities, you've got infrastructure organisations, your volunteer centres, you've got volunteering in the local authority, you've got healthcare delivered by the local authority. That is chaos for somebody who just wants to help the NHS. And it's why what we see, and is what is regularly reported to us, is that NHS trusts, particularly acute trusts, do not have much trouble finding volunteers. In fact, often they have a queue. But then we speak to organisations such as yourselves, and it's an absolute nightmare. But there's no reason why the queue outside the hospital can't be redirected to the services that need volunteers the most. And whilst we do have a huge amount of benefit from things like infrastructure organisations, your local volunteer centres trying to do that for us, you've got websites such as Reach Volunteering trying to do it as well. They have got so many responsibilities and are spread so thinly, and resources are so stretched, that if NHS and health want to change this, we sort of have to do it ourselves. And so that's where the NHS volunteering website comes into play. So let me just move to actually starting to show you the service. So it's a very, very straightforward website, and I think actually I'll come off my slides momentarily and I will try and guide you around the website instead. It's super simple. It is, as you would imagine, a go to search. You put a postcode in, you search up to 5 or 10, however far you want to travel. And for your volunteers, given travel is part of it, might be quite a reasonable search radius. And you can see, I didn't actually put that there on purpose. It just so happens that we have a patient transport volunteering role in my local area run by the South Central Ambulance Service. This is what we've created. It looks and feels and works in a very similar way to lots of the other search engines that you'll be used to using for volunteering. The fundamental difference is that it is designed to exceptionally high levels of accessibility standards. So all NHS websites and all government websites have to go through a fairly brutal and rigorous assessment to make sure it is genuinely built to an accessible digital standard that supports everybody, that makes sense, it's logical, it works, the language is appropriate, it works with screen readers, it works with other assistive technologies, you can use a translation service on top of it, this, that and the other. It is built with a level of rigor and a level of detail that really only sort of the large scale government bodies can push at a service. And so this has been designed to be as straightforward for the public as possible. At the moment, it is very much in its infancy, and whilst it is live, it is built, you can go see it on the internet. It is at this opportunity where our involved organisations can really help shape it and make sure it works for you and it works for your prospective volunteers. At the moment, it is populated with a mixture of things. So what you can see on my screen is a role, so the patient transport volunteer role. It's in Maidenhead, delivered by South Central Ambulance Service. But what you can see below is Berkshire Healthcare's sort of little section on the site, because we have populated it with every NHS trust and every NHS trust site, because we are in our infancy. And so when you scroll down, you don't see lots of roles. You see Hillingdon Ambulance Station, this, that, and the other. And we do have some national roles right at the bottom, such as the NHS and Care Volunteer Responders, that you can do anywhere in the country. So it is a little bit of a mixed bag at the moment. In a year, 2 years' time, those static site pieces of information that take you out to a NHS Trust website will come off, because by then it will be populated with all of your roles, all the NHS roles, all the everybody else I've just described roles, so that it is a really vibrant role board. It specifically exists for find and apply. It is not a content management system. It's not going to do your DBS checks. It's not going to do your screening. It is the front door for volunteering within health, and that's what it's designed to do. It has a number of other elements that are, as you would imagine, for a find and apply service. Understanding opportunity type, so support your community tends to be the main one where we would see community transport volunteering roles. These are all little sections about what it might be, there you are, what it might include, who might enjoy it. It's very simple, it's very straightforward. This will grow over time. At the moment, this is not a tagged element of the site. We're working on that to make sure the tags are right. Some of this might change based on user research about actually what matters to them when they're searching. And this is an interesting point, sort of sets it out apart from things like Reach Volunteering or Do It, or the other services. Normally you just click health and then you enter the Wild West. We're wanting people to click and be able to filter about community transport, or you want to volunteer directly with patients, or you want to do admin behind the scenes that helps patients, or this, that, and the other, that really drills down into what it means to be a health volunteer, because it is as broad as anyone could possibly imagine. You may in NHS volunteering, health volunteering, you may never go near a patient, or you may be integral to life and death for one, and everything in between. And so we want to make sure that the communication that we give explains that diversity and how it is for everyone. Volunteering in health can genuinely spark enjoyment and give people whatever they're looking for from volunteering. Gardening volunteers, for instance, the NHS estate is just chock full of little gardens left, right, and centre, and the health and well-being impacts of patients and things are huge. But most people probably wouldn't think of that unless we tell them about it. And so we want to hear from volunteers, and so we've got case studies of information about what volunteers say and why they think it's important to be a health volunteer. And that will grow, that will become more dynamic over time. It will dovetail with our communications approach, so that we can create a groundswell of interest and excitement around health-based volunteering. That hasn't started yet, because you've got to get your ducks in a row before you can go out with a big comms plan. We need the roles, we need the recruiters on board, ready and waiting, so we can bring the public to the service. I'll go back to my slides, otherwise I'll meander off on different thoughts, and we will use the full hour and a half. So we've covered all that information. What I don't have, unfortunately, is what it looks like inside. So normally my colleague Sharon comes to these, but unfortunately she's very poorly today. So that is a slight gap in my presentation. But like I mentioned, we are designing an accessible service. It's not just accessible for the public, it's accessible for the recruiters as well. So all of the things I described about using plain English, accessible formats, being able to use screen readers and different navigation functionality, that is all available to you as well, which is hugely important when we're working with so many different organisations, so many different people, different backgrounds, different mechanisms, because I'm very aware lots of people will be volunteers themselves who may be sitting on the recruiter side. And so we want to invite you to sort of take a look around in more detail with us. We have regular step through sessions that are run by the NHS Business Services Authority, which is another mysterious part of the NHS. They deliver this service on our behalf, and they support all of our recruiters. It's not a sort of self-service at the moment. We don't just give you a link and you go fill it in, and this afternoon you'll be putting roles on, because we are in this early stages of the service. It is very, very simple to do, but we will have an engagement manager who supports you so that you feel confident using the site. You have the opportunity to ask questions. It has training offered, which is so light touch because it's so simple to use. We have a contact centre which is available both for recruiters and for prospective volunteers. If you have any problems, any questions, you can always go to them and they will support you. Something I didn't mention when I was talking about the voluntary sector is that this is a service that we need to make sure that it genuinely remains true to volunteering within health. And so we are recruiting organisations who are working in partnership with a bit of the NHS at the moment. So that might mean that you have a contract, it might mean you have an MOU, a service level agreement, it might mean you have a well-established referral pathway with a clinical aspect of an organisation, a hospital, a GP surgery. You hold a relationship with the NHS in some way. We are testing out what that means, what that looks like. I'm very aware that it looks very different to different organisations. So they will ask you about how you work with the NHS when you're going through the onboarding. Having spoken to Caroline and the team, it is abundantly clear to me that if you are doing health transport activities, we will be able to sort that out and make sure that we have a way that you can be listed as eligible. It's very light touch, but it does allow us to have that rigour and assure that quality, that when the public look at our service, they're not looking at things that are irrelevant or misleading when it comes to health volunteering. And we don't want anything that is kind of goes against how the NHS delivers health, I suppose. We want it to be very genuinely, you are working with the NHS side by side to support the health of the UK. England, apologies. If you do work in any of the other nations, unfortunately this service is just for England at the moment. We do work very closely with our nation partners, so that might change over time, but for now it is an England only service, so only roles within England can be advertised on there. Obviously in border environments, volunteers can cross the borders, that's absolutely fine, but the roles, their locations need to be based in England. It's very straightforward. If you would like to find out more, get involved, we can continue to have our conversation this morning so that you can get more of a flavour. I'd rather stop talking to what I see as just plain screens in a minute and actually have a conversation with you so I can make sure we're answering the things that you're interested and want to understand about. I encourage you to go have a look around. I'll put all these links in the chat. Take a look around, get a feel for it. It's in what's called private beta, which is our development phase. So it's not super Googleable at the moment. We're working on that. By Christmas, that should be much better. As we continue to grow that, as I mentioned earlier, getting the ducks in a row, we don't want the public to be looking at a site that's incomplete. So we have to sort of make a decision about which way that goes. If you look at it and go, yeah, this seems reasonable, let's do this. There is a QR code on the screen that you can scan with your phone, or I'll put a link into a short contact form. It gives you the option to say, yeah, I'm happy, just sign me up, and they'll send you a contact form, or you want to have a conversation, you've got questions. So just pick one or the other or both, and the colleagues at the NHS Business Services Authority will get in touch and have a chat with you. As I mentioned, this is designed with user research at the heart, and that's not just the public, that's you. So if you've got thoughts, comments, ideas, you want to be involved in further discussions, then you can email the Business Services Authority by the email address on the screen, and like I say, I'll put in the chat, so you can have a conversation. The things that we're particularly interested in are how can we maximise the benefit of this service for the voluntary sector. We have very close daily ties with acute trusts, mental health trusts, ambulance trusts. That is fairly easy for us to do. But the voluntary sector in all its diversity, we need to really reach out and make sure that we're talking to organisations large and small, so that the service works for you. We want to know if we've got any blind spots. Are we overlooking anything? And we want to understand what kind of promotion and marketing support you would get most value from. You were talking about Community Transport Week at the beginning of this, and that is a wonderful example. You know, if you all have a single point at which you advertise your roles, you have one web link that you can send the public to. You can create your own campaign in that way. You can promote by whatever mechanism. You can work without any involvement from NHS England to do that, because you will all be working on the same platform for your volunteer facing recruitment. And it's not to say we would replace any of the other routes that you use, but it is a brilliant opportunity. Which makes me think about something actually that's to do with the recruiter side of the site and how you place adverts. So when you're a recruiter and you're putting adverts in, you can elect whether or not you want to use our application form, which is basic, it's straightforward, it is designed to be a really accessible, simple way for someone to get in touch with you about their interests, their availability, why they think they would be good for the role, all the standard stuff. Or you can put hyperlink into your site, your application form, your way of working. We don't want to duplicate anything or run roughshod over established processes that are allowing you to get the information you need upfront from volunteers. If, however, actually you're working off, I don't know, email expressions of interest, or you actually don't really like your volunteer form, it doesn't generate what you want, then ours is a great way to set that standard. When you log in, you can then see all the applications that you receive. You can edit your roles, you can open and close them in very simple ways, so that you can configure what is shown on our website for what you need and what you're interested in. It takes a couple of minutes to produce an advert, provided you know what you want to write, and it takes the public a couple of minutes to complete a form as well. So it is very straightforward, very intuitive, and it has dashboards that tell you, is it still in draft? Is it published? Is it closed? So that it's really easy for you to understand